Michigan is close to crossing that milestone of 1 million cases of COVID-19. Good evening and thank you for joining us. I'm Glenda Lewis. The Delta surge is pushing us closer by the day. The latest count of the new cases added more than 6,600 yesterday. We could cross 1 million total next week. 62 more deaths were also confirmed. The virus has claimed 20,597 Michigan lives. For about the first 8 months of the year, nearly 95% of the new cases, 92% of hospitalizations, and 94% of deaths have been in people who are not fully vaccinated. The virus taking center stage in tonight's 7 UpFront interview. We are joined by Michigan's Chief Medical Executive, Dr. Jonae Caldoun. Dr. Caldoun, we truly appreciate your time tonight.
Thanks for having me on.
Well, first question, on many minds, we've watched cases continue to rise as we're approaching a level of numbers where new safety measures, could they be ordered? And if not, what is the plan if cases continue to increase at this current pace?
Yeah, so I'm certainly very concerned about the trajectory of our cases with our case counts, our hospitalizations, and our deaths that are increasing. That said, I'm also very pleased that we're also seeing our vaccinations go up. So we have more than 66% of adults over the age of 16 who have at least one dose of a vaccine. So we will continue. We have been in communities promoting vaccines, but also importantly, supporting our schools with testing and supporting our local health officers as well.
Yeah, frightening time for our young people, Doctor. Talking about booster shots for the general public. We know there's been a lot of back and forth between the WHO, the White House, FDA about whether they're necessary. What is the state's stance and what do you plan to do to prepare to roll out those extra doses?
Absolutely. So what we know right now is that 2 doses of the messenger RNA vaccine, so Moderna or Pfizer, they're pretty good when it comes to preventing severe illness or deaths. We remain watchful and waiting to see what the FDA Advisory Committee and the CDC says when it comes to if the general public needs a booster shot. But we are ready. We have more than 4,000 providers across the state who can give vaccines, and they have vaccines on site to give them when a booster is approved.
Well, that is good news. If someone received that Johnson & Johnson vaccine originally, should they seek out a booster of a different vaccine?
You know, that's a great question. It remains to be seen. We really have to wait on what the FDA and the CDC say. But right now, the answer is no, but we will see what they say.
So we're talking about our kids, back to school time. We are in full swing. The safety of our students, top priority. We've seen 71 outbreaks in schools this week. Do you think there are enough protocols and mitigation measures in place for schools? And could we see any changes in the future?
So we're certainly watching that data very closely. We're also making sure our schools know what they need to do to be safe as possible, but also importantly, keeping our kids in school, in-person learning. And that means layered mitigation strategies. Of course, wearing masks, of course, social distancing, importantly, ventilation, and also testing. Those things are really, really important, and that's how we're supporting our schools.
All right, doctor, and evaluating our pediatric cases, do children seem to be more vulnerable to the Delta variant?
So I can say that the Delta variant is absolutely more easily transmitted. We're seeing cases increase in every age group. And unfortunately, we're seeing our younger age groups, so 0 to 9 and up to age 19, where we're seeing the highest rate of increase in cases. We still know that children are less likely to be hospitalized, but unfortunately, we're seeing more and more children who are having to be hospitalized from the Delta variant.
Well, we've seen reports that that Mu variant is now in Michigan. How many cases do you know there are, and should we be concerned?
So right now, more than 99% of our cases that we've been able to sequence over the past couple of months have been the Delta variant. So that Delta variant is what is causing our surge right now. We have identified some cases of the Mu variant, but that variant is not actually identified by the CDC as a variant of concern. So right now, we are laser focused on the Delta variant.
And doctor, as we wrap up tonight, with each variant, they just get stronger and more transmissible?
We knew when this pandemic started that because of the type of virus that it was, that would likely mutate. So we're very concerned that the fewer people are vaccinated and the more opportunity there is for this virus to jump from person to person, the more likely that a new variant will come along and it could easily potentially be more severe. So that's why we're encouraging everyone to get vaccinated as soon as possible. Please don't delay any longer.
All right, well, Doctor, we appreciate you leading the way for our state. Thank you for your time tonight.
Thanks for having me on.